My name is Dave Schulman. I'm CHEST president for 2022, and welcome to another conversation with CHEST leadership. Pleased to be joined today by one of my personal mentors and current CHEST president designate, Jack Buckley. Jack, thanks for joining us today. I'm going to let you share your mission with your mission through CHEST in a minute, but one of the stories that you often tell that I get a kick out of is how you at least remember, and I remember how we first met and interacted.
Yeah.
And so you want to maybe share a very shortened version of that story?
Sure. So my whole background's been medical education, and I was a program director at the very early part of my career for a while. At a time when being a program director was kind of a task. And
it's not now, right?
It's not now. Oh, this is a bona fide, validated, extraordinarily important career pathway that's absolutely necessary for our field. But back in the day, a long time ago, it wasn't. It was somebody would get tapped on the shoulder to be the program director for a fellowship. And so I didn't look at it that way. I looked, this is too important, and I wanted to advance that. I wanted to advance that role of a program director and being recognized. And I can remember at a conference of program directors for pulmonary critical care, I was asked to lead it. Now we were sitting in a group, it was a breakout room, there's probably 20 people in the room, program directors. And I asked for a show of hands. I said, okay, how many people here went up to their boss's office, knocked on the door and told their division head, I want to be the program director for the fellowship program. And I raised my hand because that was me. And there was only one other person in the room that raised their hand. It was David. And I'm going, ooh, I like this guy. I don't know who he is, but I like him. And I think that to me, when I look back, that started the ball rolling in terms of people who really sought to say, this is the career path I want to go.
I think it was back in 2005. I was trying to figure out.
I can't remember.
That goes back probably 15 or 16 years. Talk to me, because I got to know you first through both of our relationships with the Program Directors Association. Talk to me a little bit about your journey through CHEST leadership. How did you first get involved? Because I mean, you're a big shot now. You'll be president in a couple of years. Understanding the journey is different for different folks. What was yours like?
Yeah, it was interesting. So when I was in my fellowship, I wasn't fully engaged with CHEST or professional societies in general. We would get, the group would go to a big meeting and we'd all come back, but I didn't get involved in CHEST until I was at Henry Ford Hospital my first time. And at the time, one of the senior partners in the group was Paul Qualley.
Yeah.
And Paul Qualley, past president of CHEST, said, I think you should get more involved. You're a clinician, you love to teach, and this is perfect. Come on to a meeting and I'll introduce you. And he got me signed up for a leadership course back in the day. And that course was Vera De Palma and Lisa Moore. We talk about it to this day going back. That was probably my first initial exposure to CHEST. Boy, that just, everything in there was just easy and natural.
And so when was the first time you then ran for a leadership position? Certainly you've been on the board, we'll talk about that a little later, but what are the other positions that you've held within the organization?
There's been a number. Some of them were helping out with a committee on this or an educational project on that, but I probably would think that it's all been naturally through the what's now called the Training Transitions Committee. Yeah. At the time, it was an affiliate network, and this is all about, what you and I have historically valued is folks in their training and their formal fellowship training. How do you get them involved and engaged in their professional society, and how do you help them be successful in their careers? And so that's what those committees and networks at the time had been focused on, and that was aligned nicely with what I was doing back at my home institution. So that's where I spent most of my time. And then from there, I put my name in the hat for a board position and was luckily nominated, and I was surprised in a way because I thought there would be tons of people who would be applying, and I felt very lucky to get a chance to serve on the board. And that was 2013?
I think that was
right about that, which was just following up my year when I was the scientific program committee chair. And so I think that's probably where the CHEST got to know me better. And so once they get to know you better and see what you can do, then they might consider you more strongly for positions on
So
board.
I have to take a minute and tell a funny story, which I don't know that I've ever mentioned this to you,
Uh-oh.
but I always get a giggle out of it. So you'll remember, and some of our audience may who are a little bit more senior, that back in the day, and this probably goes to 2016 and before, the lead up to the annual meeting, there were advertisements that the program chairs did. And so you were part of now you know where I'm going to go, right? You were part of a memorable advertisement in 2012. The meeting was in
for Atlanta.
Yes, for Atlanta.
Yes, I do.
Do you remember what the advertisement was?
I do remember the video. So it was the meeting was in Atlanta, and as always, we try to embrace local history, culture, and there was an advertising skit on the old movie Gone with the Wind. So Doreen, who was the program chair at that time, played Scarlett O'Hara, and I was Rhett Butler.
Yeah, the little pencil mustache.
Taped on. It was actually a piece of tape on. I don't even want to know what it was, but it came in a case, and I used it once, and then it was disposed.
Jack, oh Jack, what if our meeting isn't productive? How will we go on? What will we do?
Frankly, my dear, I do give a damn. But I'm not worried. Our program committee is the best. They know the relevant topics, and they'll put together an outstanding program. They always do.
Jack, you're right. We had such a good response to our call for topics. We know exactly what our attendees want to learn. We are set to develop a marvelous program. I'm sorry, Jack, it's just, sometimes I panic.
It's okay, Doreen. Everything will be fine. Now here, take my handkerchief. Never, at any crisis of your life, have I known you to have a handkerchief.
I remember that very vividly and thinking, how did they talk him into doing that?
Well, it's part of trying to be in a good sport, right? Some things you do, you have to get out of your comfort zone from time to time. So that was fun.
Yeah, no, it was
looking back, it's fun.
It was good. I want to you mentioned the board regions. I want to get back to that in a minute. But you started with training and transitions, and one of the things, and you opened with this push for education. What is your perspective these days on how junior folks, medical students, residents, fellows, even junior faculty interact with national organizations like CHEST? How has that changed? And what, if any, advice might you offer? That's a lot of questions tied together. But what, if any, advice might you offer to young folks who are trying to figure out, like, is this a thing that I should get involved in? I'm so busy with my home institution. What are the benefits of something like that? So it's a ton of questions. We can tackle them in whatever order you want.
I'm going to start with the second one first, and is should people get involved with their professional side? Absolutely. Absolutely. I think all of us as professionals need to be engaged, not with what we do just day to day, but also on working with your professional society to advance your profession. It's like the old rule at work. So everybody has two jobs. Number one, get your job done. Number two, make your job better. And I would argue through a professional society, that is one of the ways that a lot of us can help make our jobs and our roles and what we do and our impact, which is the bottom line. How do you help patients? How do we do that better? And working with your professional society is probably one of the most important ways to do that. So I think that's extremely important. Now, how do you get involved with your professional society? I think what's fun to watch is over the last 20 years, the number of opportunities, and it doesn't always seem that way when you're in this role, for medical students, residents, and fellows to get involved is so much better now than what it was. That used to be, you would stand on the sidelines and hear about national meetings here and there and watch your professors and attending physician teachers go off to these meetings, come back, and they learn about all this new stuff, the cutting edge stuff, and you just wonder, oh, okay, am I going to get tested on that or something like that? But it was like a black box. What's inside? You didn't know. And then when you first get your chance to go to a national meeting, it's a lot of fun. It's just a whole new world. It's different types of stuff going on, and but you feel like you're a participant. You're an attendee, but you're not engaged in influencing how things go. Now we have opportunities for fellows to be involved, not just on giving presentations, but sitting on committees and playing important roles. Residents get invited, even medical students. So when we travel to all of our national meetings now, we reach out to local medical schools saying, hey, free admission to the meeting, free attendance to any medical students want to come in and present a subject,
right.
Submit a poster.
Meet leadership, play around in the simulation center.
Absolutely.
For CHEST. Yeah.
Just get a little dose of what it is. And it's a blast. We get wonderfully positive feedback from those folks. So I love those opportunities. And that just gives folks an idea of what goes on at national meetings and maybe start to make some connections and see if that's something that they want to do more rigorously when they are finished with their formal training.
You touched on a topic which I want to dig a little deeper on, which is the second part of the job, which is to make the job better. I think particularly over the last couple of years, and even preceding COVID, there's an increasing sense from faculty, and it may be the case in private practice as well, I don't know how to change things. Like, the job is tough. It's a bit of a grind. Like, I think my colleagues have my back. I worry a little bit about the healthcare system not necessarily being as supportive of individual level people. And they just they withdraw. They say, I don't think I can change things. You're a division director now. So I knew you back when you were program director. You've sort of moved up the ladder to division director. How can people lower in the levels of leadership try to do that second part of the job? What are the and I know it's a hard question, but what advice might you offer to somebody who sees opportunities to make things better but doesn't know how to operationalize those ideas?
Depends on what the idea is and how you're going to operationalize it. And I don't have the answers for every single path, but I think it does start with a sense of belief in that, this could be better. Whether it's, this treatment, this way we structure things, this way we approach diagnostic problems, this could be better. We have there's enough science out there that tells us this could be better. So how do we make this better? How do I influence that? It needs, just because we're doing the same thing, or what you don't want is to be doing the same thing in 20 years that you're doing today. So let's think about that for a moment, and where do we want to be and how do we get there? And I think you got to speak up. You got to submit ideas, and you got to be willing to try something new and advocate for something that you believe in. And sometimes that's calling out things that should probably be stopped and go away and put it aside. No, we've done that. Let's move on. That's not work. We tried it. It's not working. Let's do something different. And you have to be willing to do that. And it kind of comes back to being, I don't know, you have to, and maybe this is just personal, but we all reflect on how we're doing in terms of our own professional development. And what I learned about myself is, fairly early on, is I do better when I am being more honest and authentic about who I am and what's important to me. And that freedom to be more authentic, or that need for me to be more authentic, is extremely important because that helps fulfill my sense of purpose, right? It's like the things that you need for a satisfying career. You want a sense of purpose, and you want to work with fun people, good people. Those two things, you're going to have a fulfilling career. And so it's that sense of purpose and being able to identify that. Now in medicine, it's fascinating. I would argue it shouldn't be too hard to find a sense of purpose. And in fact, for folks who struggle with that, there's usually something else going on that's getting in the way. So if you can just always kind of put that, why you're there, what you're trying to accomplish, or the big picture, little picture, doesn't matter as long as you have a sense of purpose that drives you. And let that take you to wherever you're going to go and helps you accomplish what you want to accomplish.
I love what you've said, and I think it actually ties back to the CHEST mission a bit, because one of the privileges of getting a little older, being a little more senior, is we have a little bit more of an ability to speak truth to power without ramifications than people who are a little bit more junior. But I think when you come to a place like CHEST, where you can speak to folks like us or other people in leadership, and we're not in charge of your career at home. We can offer counsel. We can try to get the groups together and say, look, this is a persistent problem, not just in your institution, but across your state, across your region, across the country. And talking to us doesn't really put any risk to you in terms of local ramifications that might come of speaking truth to power. I actually think that's one of the things that in the advocacy space, being part of a national organization, be it Chester and others, has some value there.
Oh, absolutely, absolutely, and it's exactly those types of things. You have a personal struggle that you're working on at your own institution. Maybe it's the way it's organized, and you go, "Gosh, am I the only one having this problem at my institution?" And so you start talking with people at Emory or other institutions or other big group practices, and you say, "Is you guys encounter this? And what do you do? How do you handle this?" I was asking Steve Simpson about this the other day. How many patients does an APP in their intensive care unit cover during the day? And how many do they cover at night? I'm going, okay, that's about the same that we do. So maybe we're on track. It's this networking, trying to understand that, hey, you're not doing this alone.
Is this normal? Or is this something that everybody experiences?
Exactly.
You can only know that through networking extramurally.
And sometimes, as awkward as it might be, you realize that you might be the outlier. And you might be thinking you've got it worse when you've got it pretty good.
Yeah.
It's a little humbling, and sometimes but that's useful for you to know about yourself and how you look at things. It's like, okay, maybe I had that wrong. Maybe, and so it helps get you anchored a little bit better, I think. And really, for me, CHEST is the best place for that, is that opportunity, because we have a nice diverse group of people in different roles. You got academics, you got geographic distributions, you've got private practice groups, big, small. For me, I love running into past fellows that I've worked with, scattered around the country, and tiny little 1-2 person groups versus big mega organizations, and hearing their stories about what they're doing. That's a lot of fun. And I'll ask them questions. Oh gosh, you're out in the real world. Sometimes I worry I get cloistered in the academic culture, and you miss out a little bit on what's going out there. And then talking to them, I'm learning back from them. Yeah. And they seem to like that. They're like, oh, I can finally teach Buckley something. Actually, they've always taught me something.
Yeah. They just didn't realize
didn't realize it until then. That's always fun. But it's a great way, the networking opportunities, and people talk about this. This is one tangible way, is what you learn from that.
Let me turn to the board. So you joined the board in or around 2013. You were a member for 6 years. You stepped away for a couple of years, and now you're back serving in the president-designate role. Without getting too deep in the weeds, can you give the membership a sense of what does the board do? Like, we meet quarterly or so in person. We'll have a couple of additional phone calls throughout the year. What happens therein, and what do you think is the most meaningful thing that the board is doing that led you to kind of run for president for 2024, I guess will be your year?
Yeah, that's a great question, and I'll confess that when I first joined the board, what I thought the board does and should be doing isn't really wasn't as accurate as it should have been. And I think I understand more about what the board does and why it does that. And that is luckily through, that's part of my education in terms of board development. So, the board has changed a bit over the years, not as much as I think it had changed in the 10 years before I started, going from 2000 to 2013 is when I started. I think so I step back and go, what does the board do? What's the role of the board? Well, the role of the board is to set the mission and vision for the organization and outline what we're going to try to accomplish. And it really speaks to the cause that we all value and tries to make it into a functional organization that represents the professional interests of our members, but also our duty to our patients and why we're here in the first place. And it's the governing body. It oversees how we're going to do things. It hires the CEO. It helps establish the bylaws in terms of how things how things should run within the college. It's also the duty of the board to make sure, though, that they are grounded and have a good sense of what's going on in the real world. So it needs to represent diversity of thought and people so that it is really covering what our society needs. That's kind of how I look at the role of the board. And then there's certain things that the board shouldn't be doing. So yes, the board oversees everything and hires a CEO, but the board doesn't make day-to-day decisions about how the college runs.
Yeah.
That's a thing that I think many people who join the board, it's a little difficult recognizing that, how does this work? But this is not unique to Chess. This is how nonprofit boards work. Most of us work, or a lot of us work at hospitals that have, and health systems that are nonprofit organizations, and we think, there's the CEO and they make all the calls. Well, that's not quite true. There is a board, and that CEO is hired and fired by that board, and they are held accountable to that board. So sometimes
the only person who works for us is the CEO.
That's right.
He's our only employee as board members.
And sometimes we take this back to our home institution and goes, well, who's on the board at my home institution? It starts getting you start learning a bit about how organizations work and their structures, and you get a little insight into what goes on, not just here at the college, but that's pretty, I think, very transparent. I think it's more about what goes on at your own institution. You start asking questions.
One of the things I've admired about you, and everybody's got their own features, but one of the things that struck me very early in our relationships is you are someone who is very comfortable speaking against groupthink. Let me clarify that. No, what I mean is, and I'm not always sure that I think you are always happy to poke the bear a little bit and question the things that everybody else thinks are true. What if that's wrong? Even if you're the only person in the room to say that. I think the way you comport yourself certainly lends itself to that. But I think that modern society has trended away. I think people are a little hesitant to speak out now, like maybe they were 5 or 10 years ago. And I love that about you. You've sort of maintained that sort of willingness to step out a little bit and say, well, what if we did this instead? Or what if you say it more polite, what if this is all wrong, but actually this is the way we should go instead? A lot of people think that way. I don't know that a lot of people act that way. And any lessons that you might share is that have helped you be more comfortable speaking and just questioning the truths that we all perceive to be, things that we all perceive to be the truths?
I think it really comes back to, and I remember the first time I ever heard this term a long time ago, groupthink. What is groupthink? And it was defined going, oh gosh, I see a lot of that. I can't stand it. And because there's people sitting, there's people gathered together, and I go, what are the chances that everybody here really thinks that, yeah, I'm 100% there with you? I go, well, I don't think that's true. And so part of me that one of my motivators for speaking up is, I want people to be honest and authentic. Comes back to this authenticity issue about what they really think. And it's an opinion usually, right? It's not a strategy, or maybe it is a strategy, but often it's opinion about something. And the whole purpose to having a group is to get different opinions and different ideas and different perspectives. And so if everybody just wants to latch onto what's popular, well, why have a group?
Yeah.
Just turn it over to one person. David, you stay here. We're all going home.
It should not be me. I'm the last person you should rely upon.
So it's a way, I think, of keeping us all in check and honest with each other. And we should welcome it. We should welcome contrary opinions and thought as a way of challenging our beliefs, because we're human. We have limitations in how we process. We have limited experiences. And so how we process and interpret things is going to be unique and often isolated until you start sharing. And I'm a firm believer, and Gabe Bossett used to always talk about this book he loves, The Wisdom of the Crowd. A group of people is going to come together with much better ideas and thoughts and solutions than any individual. Yeah. No question.
I'll close with just a couple of rapid fire questions just to get to know you a little bit more personally for those who might not know you. I think I know some of these answers. What music act have you seen live and you're like, that is the best music act I've seen live?
You mean band or play?
Anything you want to share. I was thinking band, but if you have a musical you want to share, that's cool too.
I have a fairly eclectic music interests and tastes. But I don't like live concerts that get too loud. No. I don't know whether I just get sensitive hearing or what. I like listening to loud music, but I like to be able to control the mind.
Hey, can you guys quiet down on stage a little bit? It's a little noisy for me. Yeah.
I like going to, I like big band. Live performance of a big orchestra and old stuff. And you don't really have touring big bands anymore.
So not classical music, but more like brass instruments and stuff like
horns.
that.
Horns. So, okay, I'll show my age. and I was listening to the other day, is I would go see an Earth, Wind, and Fire concert in a heartbeat.
You are showing your age.
And I love because they've got a big brass
Are
section.
they still touring?
No, I don't think
Okay,
so.
I can't imagine.
But it's but that's that type of music. I grew up playing classical piano, so I have huge interest in classical music. The gentleman who was taking us to and from the hotel had this spectacular Gershwin just playing on the radio yesterday on the ride over, and I said to engage him on a conversation.
Little John Philip Sousa, maybe while they're at it.
Not so much the that
Not
so
the
much.
marches.
Not the marches.
Okay.
George Gershwin. It was spectacular.
What guilty pleasure movie? What's the movie that you shouldn't like and you're not necessarily happy to admit, although maybe you would be fine with it, but you will watch anytime it comes on, even though it's not sort of a popular hit?
I watched it the other day for a second time. It's this animated Sing,
Yes.
and they
yes.
come out now with Sing 2.
Yes, it just came out.
I had to watch
recently.
Sing 2 because Neka Setterstrom says you got to watch it. It's the best, and she was right. It was spectacular. So it's a feel-good comedy.
You have a son, but he's 17.
Oh, he don't want to watch that.
Yeah.
I want to watch
You're
it.
just watching it for you. I love that. All right, last one. What's your comfort food? What food just makes you happy? May not be the healthiest, but it just gives you joy when you're sitting down to eat it.
Pasta
Any kind, or like with a particular sauce? Or?
with a good bolognese sauce.
Nice. You make this yourself? Are you a cook?
I do like to cook. I've not made it as well as my sister and my mother can make it, but I want to learn.
Yeah.
It's all about. The key is the milk. You got to use whole milk, and it's the right way to cook it so it doesn't. It's a little tricky.
I feel like I would burn it.
It's a little tricky.
Yeah.
It's a little intimidating, but I'm committed. I want to get it down.
You've always been committed. Jack, thank you, for everything
David.
you've done for Chess. And thanks for meeting with me today.
I
Really
enjoyed it.
appreciate it. So we'll keep doing these. Thanks for joining us for another Lessons and Meeting with Chess Leadership. See you
Thank
next
you.
time.